Good evening, ladies and gentlemen, and thank you for joining us in this edition of Viewpoint here on DBS Television. Tonight we are talking about issues related to family and society, and to talk to us we have two guests. One is out of the country, one is with us here in the studio. We have Mr. Babila Stanley. He is Family Planning Supervisor for the CBCHS. That's the first time that we're having him in the studio. Good evening, sir. Thank you for accepting our invitation.
Good evening, Mr. Journalist, and thank you for inviting me. And I hope we have a good time this evening.
It is our hope and our pleasure having you, perhaps for the first time.
Yeah, thank you. It's my pleasure to also honor the invitation.
Mr. Babila is being accompanied by Reverend Father Leke Constance. He is online to Germany. Good evening, Father. Thank you for joining us in this edition of Viewpoint.
Good evening, Mr. Venantius, and thank you for the invitation.
It is our pleasure having you once again and thanking you for creating time to be part of us in this edition. Let us go to part one of the program. We are talking about family planning in Cameroon, in Africa, in our society. And we begin with question one. I begin with you, Mr. Babila. Family planning through the use of contraceptives. Is that a justifiable means?
Mr. Journalist, thank you very much for your question. And I want to say that family planning being a justifiable means is yes.
Yes, use of contraceptives is a justifiable means. Father, I am with you. The use of contraceptives, family planning, is that a justifiable means?
The use of contraceptives is totally wrong, so it cannot be a justifiable means. No.
Father says no, it is not. And Father, I remain with you. Are there any health risks involved with the use of contraceptives?
The use of contraceptives have so many health use, which are just so numerous to count. So many health risks involved.
So that is, yes, there are.
Yeah.
Okay, Mr. Babila, I'm with you. Are there any health risks involved with the use of contraceptives?
Thank you very much, Mr. Journalist, for your question. And as far as I am concerned, and contraception, it has a lot of benefits to both the mother and the woman and the babies.
The health risks, are they?
Limited health risks or no health risks?
No, or limited.
Yeah.
All right. Those were the views. Let us take part two of the show. If you are just joining us, you are watching Viewpoint here on DBS Television, and we are equally live on our Facebook page. Africa has been known for very large families. That was yesteryears. But with civilization, with the advance in technology, science and technology, there has been this wind blowing in from the Western world to talk about trimming down our family sizes. And this has to go with what we call a family planning method. Methods which are divided into two parts: the use of natural family planning method and the use of the artificial family planning method. In tonight's edition of the program, we are looking at the use of the methods such as contraceptives, and we are trying to find out, are such contraceptives, is it justifiable to use? Remember that churches, especially the Catholic Church, is against the fact that artificial family planning methods should be used. That is why we want to begin today asking, is it justifiable to use contraceptives? We begin with Mr. Babila Stanley. He is a family planning supervisor with the CBCHS. He will tell us more about it. And we want him to, according to him, the use of contraceptives is a justifiable means. Mr. Babila, can we hear you out?
Okay, thank you very much, Mr. Journalist, and for this question, which is very important. And I think the question have been in so many people's mind, even to the clients that come to us. and also to even our system, because we are also a Christian organization, and the pastors have their own opinion when it comes to family planning and providing contraceptive methods to the population. Before I move ahead, what I want to say first is, if somebody should go to the hospital for a service, it means the person is having a need for that service. And if a woman is coming in for a family planning method, it means the woman is in need of a family planning method. And like you earlier said, family planning is a way of controlling the number of children we have. And it's also a way to make a couple to get pregnancy or prevent pregnancy if they don't want. So family planning is divided into actually two sections. We have the natural family planning method, and we also have the artificial family planning method, which is what people commonly know it exists. Most people don't know about the natural family planning method, which is what women have been using in yesteryears and even our present days. And now, with the artificial family planning method, we have the use of contraceptive methods. That is contraceptive. That is where contraceptives come in. They are made in the laboratory. Research have proven them to be effective in order to prevent pregnancy and also improve maternal and the child and the neonatal health. So, family planning through the use of contraceptive method is very important, because the health of the mother is what we are looking at, and the health of the infant. And if you look at the economic situation of a country, we know that maternal mortality is the one of the factors that bring down the GDP of a country. And preventing unwanted pregnancy through the use of contraception will also help to prevent the risks of maternal mortality as well as infant mortality.
Mr. Babila, when we talk of contraceptives, can we have some examples of contraceptives?
Thank you very much. When we talk of contraceptive, we have examples like the male condoms, the female condoms, the injectable contraceptive. We have the implant, which is just like a small rod, like a stick match that is inserted under the arm of the woman. And we have what they call,
and it stays there, or for a certain moment we remove?
Yeah, it is effective for up to 5 years. But if the woman desires to get pregnant, maybe within 1, 2, or 3 years after insertion, she can go back to the clinic and it will be removed, and then she gets pregnant. We also have what they call the Intrauterine Device, which is one of the method commonly called the sterile. It is inserted into the uterus, and that can prevent unwanted pregnancy for up to 12 years.
12 years?
Yes. But if a woman wants to get pregnant within 3 or 4 years of use, she can come back to the clinic and it is removed. We also have the pills, which a woman needs to take every day in order to prevent unwanted pregnancy.
Now you are talking about the pills that they take, the condoms, the implant, and others, and you are saying that it is justifiable to use them so as to control the number of children we have, or the timing when a couple should have a child.
Thank you very much. Family planning has 3 prongs for spacing, for limiting, and for delayers. So when we talk about delayers, we have young girls, maybe they want to follow their educational career, or maybe their normal professional career, but they are married, or they are a couple and don't want to get pregnant along the line because it's going to affect their career. So they can be delayed. So they can come in for a contraceptive method which will prevent them from getting unwanted pregnancy, and thereby acting as a family planning for those people. Now we have those women who have had maybe 1 or 2 children, and they want to space, for example, give a space of about 2 years. WHO recommends that a woman should give at least 2 years before having another pregnancy. Because health-wise, it helps to improve. That 2 years gives enough time for the mother's uterus to return back to normal, or the system goes back to normal, and then the baby will also grow adequately, and then the economic-wise, the family will be strong enough to take care of the baby. So we have those spacers. And then we have what they call limiters. You can find a woman who has had almost 9 pregnancies and maybe 9 deliveries. And we know that the risk of maternal mortality begins once a woman starts seeing her menses, that means she has already entered the reproductive age.
Yes.
And the risk is higher once she starts having sexual intercourse.
Okay.
Meaning that what, to help reduce the risk, if you prevent unwanted pregnancy, which can lead to unsafe abortion, we can prevent unsafe abortion, and also conditions or complications with the pregnancy will help decrease maternal mortality. And by using contraceptive methods, whichever one the person desires, maybe condom, pills, or whatsoever, is going to help us to reduce maternal mortality.
Okay.
And before you go ahead, let me just let you know that Cameroon is one of the countries in sub-Saharan Africa with the highest maternal mortality rate.
Okay. All right. Now, let us get the views of Father Constance. Like, Father is on the line to Germany. Father, you've listened to Mr. Babila outlining the use of these contraceptives and perhaps the necessity. You are of the opinion that the use of contraceptives is unjustifiable. Father would want to hear you talk to us.
Yes, the use of contraception or contraceptive is unjustifiable for family planning from 4 major reasons. First of all, contraception is unnatural. You see, the consequence of having sexual intercourse is conceiving a child. So it is wrong to interfere with this process. Therefore, birth control is intrinsically wrong with the use of contraceptives, because the individual, if he has to control birth, he must do so naturally with a God-given mindset, God-given qualities that God has put in mind to be able to control, you see, birth. Man must not use contraception in order to control birth. That is why contraception is unnatural, because it stops the natural flow of sexual intercourse, which is the conception of a child. Second reason why the use of contraception is not something to be encouraged in the control of birth is that contraception is anti-life. Now, life is a good thing. Life is a fundamental good. It's a good thing to be alive. So those who use contraception are engaged in an intentionally anti-life act. So because they intend to prevent a new life coming into being. So it is always morally wrong to do something with a bad intention. So, thirdly, why contraceptives, the use of contraceptives is supposed to be discouraged or not good for the control of birth is that contraception is a form of abortion. Now, some birth control techniques can operate by preventing the implantation and the development of fertilized eggs. So this amounts to abortion, and abortion is always wrong. Thus, these forms of contraception is always wrong. Some birth control methods, like pills, you see, can prevent the implantation of fertilized eggs. So using things like pills always runs the risk of causing an abortion. So most of those contraceptives are abortifacient. They are actually, they lead to the abortion, which is morally very wrong. Then spiritually, the use of contraception is anti-spiritual, anti-God, because it is not the will of God for man to use contraception to control, you see, birth. Because man has the capacity to be able to control birth. He must not use something artificial. He must not use contraception, except you are telling us that man is incapable of controlling himself. Man has the capability to control himself. And the last major reason why contraception or use of contraceptive for birth control is wrong is the fact that the availability of contraceptive leads to promiscuity. You see, leads to the damaging of abstinence in man. Before the coming of contraceptives, people used to space their children. People used to limit their children. People used to delay having children. So, which means man has that capacity, that man has that ability to do so. But because of contraceptives today, a lot of people can no longer control themselves sexually. And so that is why it is morally wrong to use contraceptives to control birth. Thank you.
Thank you, Father. I remain with you. Before we take Mr. Babila, if you listen to him, he highlighted the fact that when people use contraceptives, for example, young girls, it helps them to pursue their education before they can get pregnant when they want. It helps perhaps professionals, those who are in certain professions, to delay getting pregnant before they should have a child when they want, and that it helps in the health of the child. If we talk of using the natural, if I should deduce from what you are saying, we should tie down to the use of the natural method. If we maintain with the use of natural method, these benefits that Mr. Babila is highlighting, are they possible for those young girls, these professionals, these couples to delay that pregnancy with the natural use of family planning method?
Yes, the only methods to control family planning, to delay the having of child, to limit children, to space children, is the natural family planning method, because that is natural, that is moral. So, which means man has the capacity, the ability to abstain from sex in order to delay having children. You see, in order to limit the number of children, in order to space children, that can be done naturally without any help of contraceptives. Man has that capacity. Man has the ability to control himself sexually. Man has the ability to stay without sex. Sex is not food. So, with natural planning, you don't have any use of contraceptives. And so, you can actually limit the number of children you want. You can also delay the having a pregnancy. You can also decide to space your children following the natural family planning method. You just need to study the cycle of the woman and see when to have sex and when not to have sex, and apply self-control and abstinence in your sexual relationship in marriage. And then you can carry out your studies. Remember, sexual relation is only permitted in marriage. So when you are talking of a young girl wanting to go to school, I hope you are not talking of someone who is not married, because sex is only authorized in marriage. And if you are married, obviously you can decide to space your children. You can decide to delay a pregnancy. You can decide to limit the number of children. But anyone who is not married, you cannot even be talking about having sexual intercourse, because it is already wrong. Premarital sexual intercourse or extramarital sexual intercourse is already wrong. So even the use of contraceptive is going to be double wrong.
Thank you so much, Father. Let us take Mr. Babila. When Father was talking, he highlighted the idea that is the means, the natural way that we should, space our family, our children, that we should plan the number and, delay having a child. What came to my mind when Father was talking was, if it is natural, given the advantages of spacing the children, like the World Health Organization has indicated, like you were saying, if I should take an example like animals, do animals also use contraceptives? How do animals respect that health, gap between spacing of their children or of their kids, young ones? And is it that? Because that's what I was asking myself. What about animals?
Thank you very much, Mr. Journalist. I think what Father has said, using natural family planning and also bringing in the fact that animals also procreate, and they give they bring offsprings. I think if you should have a dog, maybe if you have a dog around your house, a female dog, you realize that there are times they always go on heat.
Yes.
And after heat, when they are on heat, they need a man. And if you are the owner of the dog and you don't want the dog to get pregnant, what you do, you lock the dog inside, preventing the dog from going outside to meet with a male dog. which at that time she can get pregnant.
So in that case, that you are spacing.
Yes.
You are doing family planning. That is a restricted case with the dogs.
Yes.
What about in the wild? Where there is nobody to say, no, I don't want this dog to be pregnant today.
A similar thing in the wild, when, for example, a lion gives birth, or when she's at heat and then she has to maybe she was crossed by the lioness was crossed by the lion. Once she delivers, she has to breastfeed the baby for a certain period of time. And during those periods, the male lion doesn't, the male doesn't come closer.
Okay.
And that's also a form of contraception. And it is also a part of natural family planning, which is called the lactational amenorrhoea method, meaning that the woman breastfeeding prevents ovulation.
Is that the case with human beings?
Yes, it also happens with human beings.
So a woman who is breastfeeding cannot take in?
Apparently, a woman who is breastfeeding exclusively, meaning that she's giving the baby breast milk only, and when the baby demands, for example, when the baby cries every time, it causes what they call a negative feedback mechanism, which prevents ovulation, that is the release of mature egg, which can be fertilized.
Okay.
So during that period, even meeting with her partner, there is no risk of getting pregnant.
When the woman is breastfeeding?
The woman is breastfeeding exclusively, and the baby is below 6 months.
Okay, please, anyway, because you are already taking me to another angle, because I would have asked the question, our parents used to breastfeed for close to 1 year, more than 1 year, and spacing was more than 2 years. There were no artificial family planning methods. But then, it is still you in the health departments that are coming up to say that you can breastfeed the child only for 6 months, and after 6 months, you go away. Anyway, let us keep that one aside. We were talking about the issue of pills.
Yes.
Are these pills adaptable to everybody? Because you get in the quarter, they just know that if you take pill A, you can use pill. Is it adaptable to every girl? Or if A is a pill, I don't know the name.
Yes.
If any girl goes to the pharmacy and buys the pill and start using, is it adaptable to everybody?
Thank you very much. That is why we always give health education on family planning, because family planning is a way. And it's not everybody that just goes to a pharmacy in the quarter and then gets a pill and then you are able to take. Those pills are of two different types. We have, let me just bring it this way. The pills are made of hormones, which are the natural hormones of the woman's body. And they're of two different types. We have the pill which is combined oral contraceptive. It's a pill that has both progesterone and estrogen, which are normal natural hormones in the woman's body. And we have the pill which is just progesterone only pills, which has progesterone, which is also a natural hormone in the woman's body. So what those pills do is they help to prevent ovulation, meaning that the release of the mature egg is not taking place. So when you meet with your partner, the sperm cell goes and doesn't meet any egg to fertilize. So eventually, it's not like there's a fertilized egg before it goes, the pills goes and destroys.
But Father raised an issue before we take him. Father raised an issue on the fact that sex is only limited within marriage. And if you talk of the use of contraceptives, is like giving a leeway that we can use sex, since I am not afraid that I can. No, sex is the concept of sex is only permitted within the confines of marriage.
Thank you very much. I think when Father was saying that, I was like, okay, yes, this is very true when it comes to an ideal life situation which we think should happen in our society. But if we look at it this other way, when a girl is raped, she is not married before she is raped.
Okay.
So we have seen girls who are raped and they come, we always give them contraceptive within 5 days of rape in order to prevent any eventuality of fertilization, which maybe she never wanted to have sex. And now, secondly, if you ask every woman, they will tell you that once they start getting to puberty, there is increased hormones, that there is increased sexual desire. Now, I agree with Father. If you can control the sexual desire, meaning that you can control not having sex when you are not married, which is very
That's what should.
That's what should be. Good.
Yes.
Thank you very much. That's what should be. But now, if you find out that these women can't control their sexual desire before they get married, we don't have to allow them, and they don't want to get pregnant. So we have a role to play to prevent a young girl from getting unsafe abortion and dying because we can provide them with contraceptive method. I, for one, if a young girl should come to the clinic and I realize that she's having septic abortion, maybe she got pregnant and never wanted a pregnancy and then went to the quarter or whatsoever and get abortion and comes to the clinic, I feel a lot of pain first because I could have helped her if I met her.
If you had the opportunity
to meet her.
Okay. Now we will take further. Further, we're looking at the issue of the health risk that are associated with the use of contraceptives, and you think that there are enormous, health risk. Can we hear them?
Yeah, the use of contraceptives have so many because especially concerning pills, injectable contraceptives, implanting contraceptives, all of these are medication. And every medications have a side effect. And that is why a lot of people who use these contraceptives have run the risk of having several health issues. For example, some studies have shown that the intake of pills can increase the risk of stroke, can increase the risk of cervical cancer, can increase the risk of cardiovascular diseases and even breast cancer. You see, and the failure rate, there is always a failure rate to most of these contraceptives that at times even lead to accidental pregnancies. So you have blood clot, the risk of blood clots, you have the risk of bad diabetes, high blood pressure, migraine headache, you see, liver diseases caused by the intake of some of these pills and injectable contraceptives.
All right, Father, thank you. For want of time, we would call it off here. But then we would tell our viewers that there is part 2 of this discussion that will continue in order so that we could clearly edify our viewers. Thank you, Father, for being there for today's edition of the program.
Thank you, Mr. Genasi.
Mr. Babila, it was a pleasure having you. I think we would most tell our viewers that we will be coming back in part 2 of the program so that we should be able to talk more on this. Thank you for being there.
Thank you, Mr. Journalist.
Ladies and gentlemen, that is all we had time for this part 1 of today's edition of Viewpoint.